now what I want to do is I want to talk a little bit more about neurotransmitter nutrition. So first let's talk about, and we're going to kind of go over each of these individual neurotransmitters. First we'll talk about glutamate and aspartate, the excitatory neurotransmitters. And the excess neurotransmitters will cause the supraspinatus either to be weak in the clear, which it could do sometimes, or cause the supraspinatus to be in the over case to have the Chapman's reflex therapy localized. And the most common excesses we see are glutamate, aspartate, dopamine, probably followed by histamine, and histamine's more often in patients who have an allergy type problem. Also, homocysteic acid from homocysteine can be an excitatory neurotransmitter, as we mentioned. So this, there are times when people say, the person's not having enough glutamate or enough aspartate. And this NMDA receptor, we're talking about being such a bad thing, it's hugely important for excitatory activity, for turning on things like learning and long-term potentiation in the cell. I mean, this is a normal pathway of excitatory activity in the brain that needs to be present. When the brain on fire happens, it's usually overactive. But we could have a patient who needed more glutamic acid as an excitatory neurotransmitter, or they needed more aspartic acid as an excitatory neurotransmitter. Now, I rarely see it. I rarely see it. But it's possible you have a person who's just kind of sluggish, and their brain was sluggish, and they didn't have enough excitation. And the reason was maybe they had a poor diet, and they didn't have enough Krebs cycle. And what you'll notice is that glutamic acid synthesis comes from the citric acid cycles. It comes straight out of the citric acid cycle. And you take the substance alpha-ketogluteric acid at the citric acid cycle intermediate in the presence of B6, pyridoxal 5-phosphate, and niacinamide. And with appropriate ammonia metabolism, it will convert into glutamic acid. So there are people who could have a sluggish brain because they don't have enough glutamic acid or enough aspartic acid. So aspartic acid, interestingly enough, it looked like it didn't change the slides, but look, there's glutamic acid, there's aspartic acid, the same nutrients, CAC factors, P5P, niacinamide, and we have to look at ammonia metabolism in some of those patients. So it's possible you could need some of these nutrients to support the excitatory neurotransmitters in some patients, usually not in the brain on fire, however. So aspartame, as we said, more often problem, these are weak. Aspartame has aspartate, MSG has glutamate. These excitatory neurotransmitters stimulate the NMDA receptors, and this can lead to excess excitation, which is more often what we see, potentially cell death by apoptosis. And that's why these things can cause any symptom. That's why there's so much controversy about aspartame in particular, is that you have so many different symptoms that you can't get a cohort of people together. When you study large numbers, there's all these little cohorts, some with headaches, some with foot aches, and some with anything in between that's coming from the aspartate, and it doesn't show up. The small different individual cohorts don't show up as in the large numbers, and so some people do studies say, look, it's perfectly safe, no one has any problems with it. But if you start to break out the individual people who are sensitive to it, then you get a real problem. So glutamate and aspartate and also homocysteic acid are excitatory neurotransmitters that cause this uncontrolled calcium influx and cell death by apoptosis. So again, MSG, monosodium glutamate, the people who have Chinese restaurant syndrome are usually very sensitive to this. That's because they can't stand the MSG. Aspartate from aspartame in many supplements, is, like for example, magnesium supplement, and the biggest source, however, is the aspartame. But you get a patient who's sensitive to these substances, and they've been taking these nutrients either prescribed by someone else or over the counter, and oftentimes you have to check what they're taking because they may be taking more aspartates, fanning the flame of what you're trying to put out. Homocysteic acid comes from altered homocysteine metabolism, and the excess homocysteine converts to homocysteic acid, the excitatory neurotoxin, which also stimulates the N-methyl D-aspartate receptors. So homocysteic acid is an excitatory neurotransmitter, a neurotoxin. And it's been implicated, elevated homocysteine has been implicated for increased risk for cardiovascular disease, Alzheimer's, Parkinson's, and other degenerative diseases in the nervous system, as well as cancer. Of course, our focus this weekend is on the neurological pathways, but it's a bad molecule that needs to be metabolized properly. So here we see the normal sulfur amino acid metabolism, and we see that here's homocysteine that can go in a pathway where it gets reconverted into methionine using folic acid and B12 and a methyl group, and then it gives off the methyl group under the influence of magnesium. Methionine becomes S-adenosylmethionine, which is SAM, which is the famous SAMe. Then SAMe gives off the methyl group here, actually. So methionine under the influence of magnesium becomes SAM, the product SAMe. People can take SAMe, but what they probably really need is they need more methionine and magnesium to metabolize it, which means they need to get this whole cycle going. So I've really never used SAMe because I've never found the need to it. If I gave the proper folic acid, the proper B12, made sure there are enough methyl donors around, made sure there's enough magnesium around, this methyl group would be donated on its own like it was supposed to be. And then there's B6 that also allows the conversion of homocysteine onto cystathionine and gets rid of it that way. There's another alternative route we're not talking about this weekend that's betaine homocysteine methyltransferase that also can convert this using betaine. Then we have come down here from homocysteine into cysteine, and here's where you go down into the pathway where we get the sulfate molecule down here, and then cysteine gets converted on down into taurine. So we see that both cysteine and homocysteine, which is excitatory, and taurine, which is inhibitory neurotransmitter, come from the same pathway. And so when homocysteine gets backed up, sometimes you get more excitation, and you don't have enough taurine to go around either because the pathway's blocked, you see. So the nutrient summary is listed here: methionine into homocysteine, requiring the folic, B12, methyl donor, and magnesium, which is often overlooked in that whole cycle, and then homocysteine requiring B6 to become through cystathionine on into cysteine. Now, I wrote a paper at the ICAK annual meeting. I presented it in Chicago in 2003, and it was called "The Roles Played by Homocysteic Acid, Aspartate, and Glutamate, and Activated Forms of Folic Acid, B12, and Vitamin B6." And basically that paper was about these pathways that we've been talking about, but what I said in that paper was my clinical observations, which still stand to this day, were that the patients I had who were sensitive to MSG and the patients I had who were sensitive to aspartame, because not everybody is, but the patients I had that really had trouble with that were those patients who had a need for one of these nutrients, B12 or folic acid or B6 in their activated forms. And so these genetic patterns of especially the 5-MTH reductase SNP would set up patients who didn't have active folic acid, so they couldn't break down homocysteine, so maybe 30% of the population. What that does is the patient has that as a big issue. The homocysteic acid builds up, overstimulates the NMDA receptors, and makes that patient even more susceptible to addition of more aspartic acid or more glutamate from these dietary sources. Whereas these are natural neurotransmitters are working all the time, but all of a sudden you've got this inability to break down homocysteine. The homocysteine becomes homocysteic acid. You've got all the time then from this metabolic block, usually due to the most commonly due to the need for more 5-methyl tetrahydrofolate, but it could be B12 or B6 in their activated forms. But what happens is then all of a sudden this neuron's getting beat up all the time from the metabolic backup of this homocysteic acid, and you add a little more aspartate from the diet from aspartame, add a little more MSG from the diet from MSG causing glutamate in the diet into the central nervous system. It gets across the blood-brain barrier, and poof, you get a bunch of symptoms and a flare-up. And that's why I found in dozens of patients, like dozens and dozens of patients, even when I wrote this patient, it was about 30 or 40, when I wrote this paper, it was about 30 or 40 patients at that time, who were the ones who were sensitive to MSG and aspartame, were the same ones that had a need for the activated form of folic acid, or sometimes B12 in methyl B12 form, or sometimes B6 and pyridoxal 5-phosphate. But by far the most common was the 5-MTHF. So all of a sudden that made a lot of sense to me, because now I wondered, why wouldn't everybody have a problem with aspartame? Because not everybody weakens on it. Well, the ones that really have problems with it are the ones that have the SNPs for folic acid, or maybe problems with homocysteine in another way. Does that make sense? Okay.